Hello, my name is Malissa Saini. Today we'll be talking about patient advocacy. How do we become the best advocates for our patients? First, let's talk about what it is to be an advocate. An advocate is someone who publicly supports a person, cause, or policy. Now, a patient advocate is someone who helps guide patients through the healthcare system and looks out for the patient's best interest. What is the importance of patient advocacy? Patient advocacy is one of the most essential components to patient-centered healthcare. Healthcare advocates are knowledgeable about the healthcare system and patient rights. Healthcare advocates are able to effectively communicate with both the patient and the healthcare team. Patients may be less anxious knowing that they have someone on their side who can point them to the right resources and a path to better care. Let's talk about some of the important qualities in a patient advocate. These qualities are communication, promote patient safety, empowerment, and rights, knowledge of medical terminology and the healthcare system, understanding of how healthcare is financed, resolution and follow-up, maintaining and ensuring patient confidence, being proactive, improving systems and policy, relationship building, and professional development. One of the examples of an advocacy issue that I've had at my facility is listed here on this slide. A patient is sent down to the X-ray department for full AP and lateral standing scoliosis films after major back surgery. The surgeon and the ordering doctor want these films as soon as possible so that the patient can be discharged. The nurse assures the patient has had physical therapy and can stand on their own. When the patient comes down, they can barely stand on their own. They are extremely pale and state that they feel like they are going to faint. In addition, the parents of the patient say they have not gone through physical therapy. Do you do the best you can and continue with the exam? Let's resolve this issue one step at a time. Thank the parents and the patient for coming down to the department. Explain what the exam entails and why we must delay the X-ray for a later date. It's unsafe for the patient to stand. Patient has not had enough physical therapy, and the patient is feeling faint, and this could be a fall risk. Call the nurse that is taking care of the patient and explain why the exam needs to be delayed. This is a patient safety issue, and we need to get clearance from PT before the patient comes down to the X-ray department to stand. Further explain to physicians if you get kickback as to why the exam cannot be completed. Explain that it is unsafe for the patient and that if they want to physically help hold the patient for the exam and take responsibility, then that can be arranged. Otherwise, the exam can be done when the patient is more stable and cleared through physical therapy. How the issue was resolved. Communication is key here. The issue was resolved by communicating first with the patient by learning of their ability to stand and how they were feeling. Then we communicated with the healthcare team and determined that the study was not safe for the patient at this time. We all agreed that the exam could be pushed to a later date due to safety concerns. If a patient falls after a major surgery such as this one, it could be a major liability on the hospital. The patient may have to repeat the surgery or suffer life-threatening complications from the fall. It is better to be safe. Thank you.